Depression is primarily a disorder of mood. So the various signs and symptoms of depression are like feeling low, feeling a lack of interest or pleasure in previously pleasurable activities, feeling tired most of the day, feeling very lack of energy, not up to it, a lack of attention or focus in what we are doing, due to which many errors creep in, feeling hopeless or pessimistic about the future. No, things are not going to improve. Feeling worthless about oneself. No, I have not been of use to either my family or the society. I'm just a waste. I'm a burden on everybody. Impaired sleep, loss of appetite, loss of weight, loss of libido. These are all some common signs and symptoms of depression. If any of these are evident in an individual, then it is perhaps a sign that the patient needs further assessment for depression. Now, when to take to a psychiatrist or seek formal mental help? Whenever the depression is associated with risk of harm to self or others. Like say for example, the depression is now at a stage where they are contemplating ending their life. And we have previously talked about some warning signs for suicide. So when any of those signs accompany depression, it is a sign that the patient needs formal help. Or if the patient is not taking his meals properly, or if the patient is not going to work properly, then these are real red flag signs where he needs some formal help. Otherwise, some simple strategies like yoga or some exercise or a change of environment or a change of place, just get away from this stress-inducing situation and take a break, take a holiday. Such strategies may work out for minor depression. But if risk of harm to self or others through poor feeding, not taking work, not going for work, or thinking about ending their life, if any of these are present, then we really need to think about formal help. Checking for a cause is very important, because often removal of the cause might alleviate some of the symptoms of depression. Like especially we call it adjustment disorder in medical parlance, where say for example a new job place has brought about stress and has led to depression. In such cases, trying to manage the work stress at the job place, which would have come if you had made a proper inquiry about the result of about the cause of depression, that is likely to help alleviate some of the symptoms. But in certain other cases, the depression may arise even without a cause, especially in people who have a family history of depression, who are biologically predisposed to depression, or who are using substances. Using large amounts of alcohol, using large amounts of substances are known to induce depression by itself. So in such cases, cutting down the cause, like cutting down the alcohol, cutting down the source of stress might help. But in cases where there is no evident cause, it might be more helpful to work on the symptoms per se rather than the cause.